Celebrities or models are ageless, right? They look just as good as they did when they were in their 20s or 30s. And what's your secret?
Amal Clooney or Kim Kardashian?
A lot of times it happens with noses. That, for me, that's the number one procedure that is subtle, but yet very powerful. I would say the vast majority of every single patient is interested in doing something that either bothers them or they'd like to see corrected, which in essence is going to help boost their confidence. Educating yourself on skincare and educating yourself to be more preventative earlier will allow you to...
Welcome back to Confident Secrets Season 3. I'm so excited to be kicking off this new season with someone very special and actually our first man on the show. As you know, this podcast centers around women's presence, power, and confidence, but today's guest works closely with women every single day, helping them step into their next level through transformation and refinement. Dr. Jason Champagne is a celebrity facial surgeon. What really sets him apart is not just his artistry and precision, but also his understanding on how confidence show up through our appearance. I know your biography is very impressive. Let me pass the mic to you so you can do intro better than me and tell us more about who you are and the heart behind your practice.
Sure. So I'm Dr. Jason Champagne. I'm a facial plastic surgeon. I'm also a hair restoration surgeon in Beverly Hills. I have been in practice almost 12 years now, and I treat patients from around the world for different reasons. I'm a cosmetic facial plastic surgeon, so I'm dealing with aging patients. I'm dealing with younger patients who want to be more preventative and that sort of things. Tying into your podcast here, as far as confidence goes, I would say the vast majority of every single patient walks in my door for a consult is interested in doing something that either bothers them or they'd like to see corrected, which in essence is going to help boost their confidence because it's something that they really are concerned about and it affects their daily lives. I think part of my job is to understand where they're coming from, what their goals are, what they want to achieve, and then see how we can work together to achieve those goals.
Thanks a lot. I cannot wait to dive into those details. I have so many questions to you. But before we go into this juicy stuff, I want to start with a quick fire this on that question. So just for fun, no pressure, just to say what comes to mind first. So let's go. So coffee, tea, or matcha?
Coffee, tea, or matcha? Coffee for sure.
Morning power routine or evening rituals?
More morning.
Being center of attention or the power behind the scenes?
Not center of attention for me. I'm more behind the scenes.
Do you like more bold red lip on women or clean girl look?
I like more natural.
What do you prefer for yourself? Vogue cover or TED Talk?
TED Talk.
Amal Clooney or Kim Kardashian?
Amal.
And to finish, martini or champagne?
Neither, really.
Okay.
Drinker, so
I was hoping you will answer champagne. Okay, let's dive into our conversation. So you're internationally recognized for your work, but I'm curious what truly drives you because you have literally reshaped how people see themselves. So maybe you can share any most powerful transformations you have witnessed, maybe in your patients or even in yourself through your work.
I have lots of patients from all over, from different walks of life, different jobs, different careers, different things that they go back home to do after our time together is done. So I would say that as far as transformations go, I mean, they can be very small, very minor. They can be very intensive and all-encompassing when it comes to a full facial rejuvenation. It's not so much more transformations to me. It's more of rejuvenating or enhancing. And I would say that my goal is more of a natural approach, more conservative to where my patients, when it's all said and done, look more youthful, refreshed, rejuvenated, but not overdone. And that it's not obvious that they did something cosmetic. More that they just look refreshed. Maybe they went on a long vacation and they don't look as tired, for example,
Mhm.
or something like that. So my goal is to have my patients' friends or family members who maybe haven't seen them in a few months or so say, "Wow, you look great. Did you go on vacation, or did you cut your hair differently? What is it that you
Mhm.
did?" But it's not, they will never point to any sort of procedure that maybe they did. But I think when it's all said and done, I've performed many, if you want to call it that, transformations for patients who go about their daily lives afterward and are very happy as far as confidence goes, to tie that into what we're discussing today.
Mhm.
For me, I think it's extremely important to help patients achieve their goals that maybe will help them be way more confident in their daily lives.
So you work with faces every day, and I know regardless of what people say, like don't judge a book by the cover, but the reality is that you will not have a second chance to make a first impression. So what's your perspective on first impressions? Maybe not just in terms of beauty, but also in how someone carries themselves.
For me, the most important thing, and what I've always done my entire life, and I'm just speaking for myself, is just be your authentic self. Just be authentic. Like, you are who you are, and people will gravitate to that. I think if you're trying too hard, it oftentimes doesn't work out as well for you. So being your authentic self, first of all, I think will give you more confidence because you're not trying to impress. You're just being yourself, and people will really latch onto that.
I have another take on this, but I will leave our audience with your answer, and very curious to know what our audience to think about the authenticity and how we show up. Because my belief is that to be authentic and to be confident is one thing, but confidence is like inner feeling, and to be authentic is inner feeling, and how people perceive you is a little bit different. So your job as a person also to make sure that other people perceive you in the way you want, and sometimes it takes a little bit more than just to be confident in yourself, but also make sure that other people perceive you in the way you want them
Yeah,
to perceive you.
I think that's true. But everybody sees that differently. Everyone's going to have a different approach to that. All I'm saying is being your authentic self is going to come off a lot better than trying too hard to be something you're.
Hmm. Yeah,
That's
agree.
But yes, you obviously want to try your hardest for people to perceive you the way you want them to perceive you. Of course,
Mhm.
that makes total sense to me.
And I know you're known for your natural looking results, right? So, what's maybe one small detail or subtle feature that most people overlook, but when they refine it or change it, it makes the biggest impact on their confidence or how they feel about themselves?
One of my most popular procedures is my champagne brows procedure. And so I have a lot of patients who reach out to me for my expertise in creating eyebrow looks for them, replacing hair that has been over tweezed or trauma or for any reason, maybe has always been sparse. I have a lot of patients that their eyebrows really bother them the way that they look. They're not full, they have patches that are missing, or they're just not a complete brow. And so I would say for me, that procedure, the champagne brows procedure, really helps patients achieve a more youthful look when you have a fuller brow or a more complete brow, something that frames your face, sets up the balance for your eyes and your nose and the rest of your facial features. For me, that one procedure, when it's done well, and in my hands, that is always my goal, can really make a huge difference in someone's appearance. And it's very subtle. It's a subtle thing. A lot of people wouldn't consider an eyebrow transplant as being something that would make a huge difference in someone's appearance, but it really does. And again, being as subtle as it is, it's not like we're going from sagging skin to now lifted skin, or sagging eyelids to now no sagging skin on the eyelids. We're just recreating a fuller eyebrow, which a lot of patients pencil in every day. So giving them that full hair look can really change things. That three-dimensional look. and not have to worry about drawing them in accurately every day or spending all that time. I think that for me, that's the number one procedure that is subtle, but yet very powerful.
Wow, I love that because it's really new to me, and I'm sure it will be new to many of my audience. Actually, yesterday shared your account with my friend, and she checked and like, I need that, I need this brow thing. I was like, what's it even about? I didn't even know. It's so cool. I agree with you because it's very tiny thing, but as you said, yes, it frames your face as a picture and like sharpens your even like just eyes or just the way you look without huge transformations. So
Yeah.
cool.
Yeah, it's very impactful. And for those people out there who have good eyebrows, it may be hard to understand what the issue would be when your eyebrows are a little more sparse or patchy. But for those people who deal with it every day on a day-to-day basis, and they want to present themselves as best as they can in social situations or in professional situations, the eyebrows really make a huge difference. They're one of the most important features on the face, as far as I'm concerned. And lots of studies have been done that show that eyebrows are extremely important when it comes to recognizing other facial features. They've done studies, for example, where you take away the eyes, but you leave the eyebrows on celebrities, and people can recognize that celebrity face without the eyes much better than they can recognize that face without the eyebrows and the eyes still present. So you take away the eyebrows and you just have the eyes, it's much harder for people to recognize that face. So the eyebrows are extremely important for facial recognition and for setting up the balance of the rest of the face.
Okay, so one serious question I have for myself, and I also received from my followers because I shared that I will be talking to a secret guest, and if someone had questions, they sent me an Instagram. So, how do you know when someone is truly ready for the procedure? Because maybe sometimes they need like just a little support from a therapist or change their lifestyle routine, have better habits, or just simply have time. How can you tell that yes, surgery is the right step or just a quick fix?
Well, so in our profession, we are trained. Part of our training is in recognizing those patients who may not be seeking a procedure for the right reasons. It may not be beneficial to them to undergo a procedure when what they're really needing is, like you were saying, more of therapy in a certain situation where they're focusing on one thing, but in reality, the issue is more of a mindset or more of and there are disorders too. There are body dysmorphic disorder, for example, where patients focus on things that aren't necessarily there or aren't necessarily the root of their issue. So we are trained to sort of figure that out. There are questions that we ask. There are also questionnaires that can be given to the patients to fill out, and that helps to sort of figure out where patients fall in that category of possibly not being appropriate candidates for surgery because that won't be the right answer for them. So that's just part of our training to do that. It happens during the initial consultation. Sometimes you can even pick it out when the patients call the office or email the office for a consultation. Certain things that they might say in their consultation request might sort of tip you off to going, I'm not sure that this patient is really looking in the right place for the answer, I guess, for lack of a better way to describe that. But there are ways to pick that out. And we do maintenance of certification exams, and sometimes a lot of our questions are involving being able to figure out who falls in what category and whether or not they're a good candidate for a procedure, or whether they need to seek therapy or a referral to, say, a psychologist or something like that. And so that is part of our profession, and it is part of my job to help figure that out.
Okay, thanks for sharing. I think it's very important for many people to hear that and to know that they will be supported in any way, either by you or by professionals from the area which is needed. You work under a lot of pressure, I believe. It's about precision, also to be like, in time. And do you have any personal habits, maybe mindset shifts, or even sometimes wardrobe choices that help you to get into this zone of comfort and precision before any procedure or just going to work for a consultation?
For me, and a lot of people may not realize this, but what or surgeons, or anyone in general, but surgeons, facial plastic surgeons like myself, it can be very taxing on your body. It's a very physical thing to be in surgery for hours at a time, focusing, performing on a day-to-day basis, and that's just part of our training. That's why we go through residency training for so many years before we're out on our own, is to sort of build up our stamina and to realize what it takes to be a surgeon. One of my routines is I'm big on staying healthy, eating healthy, and also going to the gym and being able to keep my body in a physical state that allows me to perform at high levels on a day-to-day basis. And so those are the things for me that I really focus on to be able to perform for my patients and give them what they deserve every day. So for me, it's health. It's staying as healthy as possible, eating healthy, and physically staying as healthy as I can by my daily workout routines.
You're working with clients and help them to transform their, let's say, confidence or perceptions. But if we flip a lens for a moment, and this is a question I'm discussing with all my guests, maybe you can share some personal stories. Maybe there have been times where you yourself didn't feel confident enough and something has changed. Maybe you've done some work, mind work or some physical work, and something has changed. Maybe you have some story. Many people share stories from childhood when they were forced to talk in public or something. So maybe you can help us understand what helped you to rebuild or evolve or level up your confidence.
I would say one of the big turning points in my life was involving me getting to where I am today. In undergrad, college, it's very competitive to get into medical school. And you're in classrooms with all the other pre-med students, and it's extremely competitive, and everyone is performing at a high level, and you have to figure out how you're going to stand out against the next guy or girl. In college, in undergrad, there came a time where my confidence level was pretty low because I was looking at everyone else around me and going, I don't know if I can really stand out. What can I do to stand out? We're all at this high level and we're all performing at this high level. And so it it took a lot of speaking with friends and family and just working as hard as I could to get me to a place where I felt confident enough, because ultimately you have to go through these interviews with the medical school committee and answer their questions and let them tell them who you are. They want to know who you are because everyone has the same grades. Everyone has done all of the prerequisites to get there. So you ultimately need to show them who you are. And for a while, I struggled with trying to figure out how I can stand out. And this ties into what we talked about earlier. I think it's about just being your authentic self. And so when I went in there, I had worked myself up so much, but I went in there and for whatever reason, just talking about my own past accomplishments or talking about my own past experiences helped me to stand out among the others. And I think, and then ultimately I was accepted to medical school, and then here we are. But that was a big turning point in my life where there was also a question like, this is all I really want to do. I want to be a physician. I want to be a surgeon eventually. And what if that doesn't happen? So that was the big thing for me was you can be at a very low level of confidence when or self-doubt, I guess. And that's a struggle for a lot of people at some point in their life, I think. But for me, it was really surrounding myself with good friends and family that sort of helped me get to the point where I felt confident enough, to move forward and really reduce that self-doubt.
Great story. So I think for you, to be surrounded by right people, and also very important, having goal. When you have this clarity, when you have this goal, like the rest probably doesn't matter. So you just go to this goal.
Yeah, no, that's very true. Hard work, all of that
Mhm.
plays into it. So yes, and you're right. Surrounding yourself with the right people, the people that will move you forward and not keep you from achieving your goals. You want to have that good support system, and that's partly on you to sort of figure out who's right for you and who's not, I think.
So for anyone who feels that their appearance is holding them back, what would you want them to know? How do you guide people in finding this balance between outer transformation and inner empowerment?
And all I can do is speak from my experience with my patients, I guess, because I am not a psychologist or psychiatrist or by any way a therapist, but seeing transformations with my patients or, in consultation with them, just listening to their stories helps me figure out where they lie, like we were talking about earlier, whether or not they could benefit from a procedure and that will help them, or we can perform a procedure and then they're still not happy. So we have to figure out who's going to get that confidence boost and if they're in there for the right reasons. And so that's number one. We have to figure that out. Once we do that, if we figure out that they're a good candidate for a procedure, then I also have to make sure that their goals, what they want to achieve is reasonable and fits within the realm of what is possible, number one, and that their goals aren't beyond what I can achieve. So that would be the second thing that we need to figure out during that consultation. And so that's all part of the time that I spend with my patients, getting to know them, getting to understand why they're there, what their goals are. And then we can come to an agreement after I discuss all the limitations of what we can do, all the possibilities of what we can do, and come to an agreement as to what we're looking to achieve. I think that's how we can figure out what I can do for them to help them boost their confidence and make that transformation that will fit with what they're looking to achieve.
And before we wrap up, I have again several questions I got from my followers. So if you allow, it's about your practice, about some professional advice. You can go as far or as deep or as short as you want. So first question I got is very interesting. Do you ever receive the requests from people who are coming with a picture of celebrity and saying, I want to look like her? So how do you handle those requests?
It does happen. It does happen. A lot of times it happens with noses when we're considering rhinoplasty to correct irregularities of the nose. I have some patients that present certain photos of celebrities or of other people just in general that they have seen on the internet. They may not be celebrities, but just models or pictures or whoever. The thing that a lot of people don't necessarily realize is that everyone's face is unique. And so what we can achieve on your face is not what I can achieve on someone else's face. And just because someone has this type of nose in a picture doesn't mean that that would work on your face, first of all, that it would balance with your facial features, and that's a reasonable way to approach things. So we can't just take someone's nose and put it on your face and expect it to even look the same. It could be the exact same nose and it won't look the same because we're also looking at it in balance with the mouth, the eyes, where the length of the face, the width of the face, all of that matters as far as the aesthetic look of a certain person's face. So it's not reasonable to expect to achieve someone else's nose. Now, my goal during the consultation is to show that patient what we can do for them and how that would balance with their face. It also goes with eyebrows, for example. If someone comes in and says, I want this person's eyebrows. But if I put that exact eyebrow in that person's face, it may not work well because it's not in balance with the rest of their features. The main thing that I have to get my patients to realize, and it's not as common as I think it used to be. Many years ago, surgeons, plastic surgeons, facial plastic surgeons would tell their patients, bring in pictures of noses you want. And I think that's the wrong approach. We've realized over time that that's the wrong approach and that doesn't really work. We've gotten to the point, I think now, where a lot of people do realize that it's not a good idea to try to have someone else's nose. But occasionally I still have that patient that might show up with that question. And I just have to counsel them on the possibility. and the limitations of surgery.
Interesting. Okay, another really popular question I got is, can I save up just money, do nothing, and then when I'm 50, 55, just do the full facelift and that's it?
You certainly can. We can do that. It's not necessarily ideal to let and everyone's different. You don't have to do anything. You can Everyone's opinions on beauty and what they want for themselves is totally okay. So
Yeah, but we assume that those women who participated in my questionnaire, they really want or just at least have an eye on these procedures, but I'm not sure. So that's why
yeah,
they want to know opinion of professionals, because maybe they're afraid of something or they don't believe in the procedure. Talking about me, honestly, even if I want something, I'm so afraid. I don't know, it will take time for me to
yeah,
even to get ready. So the rest of my also friends and colleagues and people who participated, they are very curious and interested, but maybe there are so many myths or just misinformation.
yeah,
So let's assume that those people, yes, they want to do something, but they just don't know.
sure. Well, I would start with a consultation with a professional. So I can say that we have a significant amount of technology available to us and things that are available to us now that haven't existed in the last 20 to 30 years that are now available that I can use to be more preventative. I think the goal that most of us facial plastic surgeons and our approach is more of from a preventative standpoint. The earlier you start certain things, the better. The more you can understand skincare, even just simple at-home skincare, avoiding the sun so that you don't damage your skin. UV radiation significantly ages us, obviously can lead to skin cancers as well. The very simple things as far as skincare goes, just starting at a younger age and understanding and educating yourself on that can really help to keep you looking more youthful and keeping your skin looking more healthy through the years. There are also in-office procedures that are very minor that can be used to be more preventative. And it all depends on each person's comfort level. My goal is to explain to you what we can do and give you the risks and the benefits. And then it's a conversation between the two of us to sort of decide what's best for you. Every patient gets an individualized approach when you come to see me. For me, my goal is to have patients be more preventative through the years so that you don't need to get to that point where you're 60 years old and you've allowed everything to sort of droop and age, as we all naturally do, and then we have to try to reverse that. It is a lot harder to do that, to achieve that more youthful look, when you've allowed your skin, and maybe, let's say, for example, it's someone you didn't do anything, no skin care, no any preventative treatments. It's a lot harder to achieve that result for that type of patient, that ideal result, than it is for someone who's been more preventative and has aged a little slower over time because they've done some minor preventative procedures. So for me, it's doable. To answer your question, it is doable to have that approach and do the full on brow lift, face lift, neck lift, eyelid lift, all at the same time. But if there's anything that I can pass on to your followers and listeners, is educating yourself on skincare and educating yourself to be more preventative earlier will allow you to age more gracefully, age your skin to age better, and prolong that need for that bigger procedure down the road, if that is indeed what you're looking to do. And there are some people that say, let's say you look at certain celebrities or models or whoever who've seemingly are ageless, right? Like they sort of look just as good as they did when they were in their 20s or
Yeah.
30s, and people, what's your secret? It's more preventative things and educating yourself on what you do to get to that point where you can still look great, and little minor things that you do over the years versus letting yourself age and then all of a sudden going back to 20 years younger.
And another very popular question and request, I know you mentioned about eyebrows, but what about blepharoplasty? Because I know many women are interested, but it's really scary procedure, at least for me. So when do you, is there like any age restriction when and for whom it's recommended in terms of like, I don't know, 30 plus years, 40 plus years?
Typically a blepharoplasty, which is where we remove excess skin from the upper eyelid or the lower eyelid, or excess fat that lives around our eyes that starts to bulge over time as our skin and the tissues in our eyelids starts to become more lax. The fat tends to bulge a little bit, so some people start to get these bags under their eyes or that bulging fullness under their eyes. And what that typically or usually is just the sort of fat that surrounds our eyes is starting to bulge forward over time. Blepharoplasty addresses both of those issues, the excess skin and or excess fat. And surgically, I can remove that excess tissue to bring your eyes back to a more youthful appearance. Typically, those procedures start age-wise. Most of my patients at the earliest are in their 40s for some, depending on how you age. Again, also depending on, did you start skincare earlier? Were you doing any preventative procedures to minimize the aging of the skin? Also, genetics plays a big role in how we age, and some patients see skin laxity a lot sooner than others. I can remember during one of my training years, we performed a blepharoplasty, and I say we, it was my mentor and myself when I was still in training. We performed a blepharoplasty on a patient who was, I think, 36. But at that stage in her life, she already had so much excess skin that it was hanging down onto her eyelashes and was in some way obstructing her vision a little bit. And so there are reasons that we can perform those procedures on patients who are younger, but more often than not, the blepharoplasty procedure is typically at the earliest in the mid 40s or so, and obviously can go up from there, 50s, 60s certainly, but everyone's a little bit different.
And do you have any online consultations? Because some of my followers are in Australia, and this particular question was from them, from Europe as well. So, or only in person visit?
Ideally, it's in person so that I can do a physical exam on you. However, especially since COVID, we have a lot of platforms that allow us to do virtual online consultations. And many of them, especially my eyebrow hair transplant, my champagne brows procedure, more often than not, I would say I'm doing virtual consultations for those patients. What I do is we have a platform where patients send in certain photos where we give them instructions on how to take the photos of themselves at home with good lighting or as good lighting as possible. They submit the photos that allows me to see their photos, and then we meet like this virtually and have a consultation about their goals, just as if they were sitting in my office. The only thing that I can't do during that consultation is, again, physically feel the tissues, feel the skin, look at the nose, look inside the nose. So for certain procedures, certain ones I have to say, we've talked about the risks and the benefits and the possibilities of what we can do. I think you're a good candidate. However, to fully confirm that, I need you to come into the office so that I can look inside your nose. I can't do that like this. What that means is occasionally a patient may come in and I have to say, I don't think we can achieve your goals because I wasn't able to see you in person the first time. And it's rare, but that may happen. So I always tell my patients who I'm doing a virtual consult with that there's still a possibility that you may come in for that exam in person. And I have to say, I don't think we can achieve your goals. It's rare. It's very rare. Many
Yeah.
times virtual consultation can get us to the point where I feel very confident that I can achieve your goals, and then we can just move forward from there. And then we just have out of town patients typically come in within a few days before the set procedure to do if we have to do blood work or check their heart and all those things. They can also do that at home oftentimes with their doctor, or if they're minor procedures and we don't have to do all of that, a lot of times they can just come in the day before the procedure. For example, my champagne brows procedure, most of my patients come in town a day or two before that procedure, we meet in person, and then we already have them scheduled for the procedure.
Maybe also to continue, maybe you offer some packages for clients out of town. Maybe you can expand on this and also tell our listeners where they can find you and what else you can suggest so they can learn more.
Yeah, absolutely. My practice caters to patients from all over the globe, and every single patient is a VIP in my eyes and in all of my staff's eyes. We give everyone that VIP treatment. We have packages, for example, and what that means is my staff will reach out once we talk and we decide that you're a good candidate. My staff will reach out, say it's a virtual consultation. We'll reach out to you to talk about costs, to talk about scheduling. If you do move forward with scheduling, we send ahead of time. There's a certain time limit. We'll send all of the paperwork that kind of start reading about pre-op and the post-op instructions and what to expect. Obviously, anytime if you have questions, you can reach out to us and my staff will, or myself will answer your questions. We also have local hotels that we work with that give us codes, or you mention my name that you're having a procedure with me, and they will give you a courtesy reduction in cost to stay at those hotels that are local, that are within walking distance of our office in Beverly Hills. We have a couple aftercare facilities that we work with that are one-on-one nursing. So for the more or the general anesthesia procedures where you're going under anesthesia to have procedures and you need aftercare with a nurse, we have those facilities that will come to the operating room after the procedure. We have our own operating room in our building. It's an accredited outpatient surgical center, and they'll come and pick you up, bring you to the outpatient care facility for an overnight stay. The next day, they'll bring you back to see me in my office for a follow-up, and then you can stay with them however many days either I would recommend you stay or however long you feel comfortable with during that post-operative recovery phase. So it's a very VIP treatment, that all of my patients will get. And I think that's what helps us stand out, number one. And it's what I expect all of my patients to experience. It's all part of it. The more we can do to help you, the better you're going to heal, the more comfortable you're going to feel with your procedure, better the results you're going to achieve ultimately. So if you're looking for us, my website is jasonchampagnemd.com. You can find me on Instagram at Dr. Jason Champagne or Dr. Jason Champagne. Phone number 310-859-2379. That's US. But yeah, anyone, anywhere around the globe. I'm happy to help take care of you.
That's amazing. Thanks a lot. For sure, I will leave all the links below on YouTube. So make sure that you follow Modern Day Life, Dr. Jason Champagne, his practice. I will leave also a website link. And I hope that you found this conversation and tips so inspiring, the same as I did, because it was very interesting for me. And I received a lot of new information as well. Now, any last words you want to share with our audience in terms of maybe inspiration or expectation?
I think just reiterating, put your best foot forward. Focus every day on being true to yourself, be your authentic self. And like you said earlier, give to people show yourself the way you want people to perceive you. And I think that's the best thing that you can do. I think this has been great. I really enjoyed my time speaking with you.
Thanks a lot, and stay connected, and see you soon in the next episode of Confident Secrets.